Hello, this video presentation is on the hormone progesterone, which is released by the corpus luteum in the ovary. Progesterone is a hormone created when an egg is released from the ovary at ovulation. During the menstrual cycle, where the remnants of the ovarian follicle that includes the developing egg form a structure called the corpus luteum. So structural details. This structure right here is cholesterol, and this image shows how cholesterol is synthesized to progesterone. It's a type of steroid, and it could be found in the ovaries. The signal responds to an egg being fertilized. So some functional details is, so why do we need progesterone? What does it do in our body? Its main purpose is to prepare the body for pregnancy if the egg released is fertilized. If this occurs, then progesterone stimulates the growth of blood vessels that supply the lining of the womb and stimulates glands in the womb to secrete nutrients that nourish the early embryo. It helps to maintain the womb throughout pregnancy by preparing the tissue lining of the uterus to allow the fertilized egg to implant. Progesterone is still produced by the corpus luteum and is essential for supporting the pregnancy and establishing the placenta during the early stages of pregnancy. The placenta takes over progesterone production at around 8 to 12 weeks of pregnancy once it is established. Progesterone plays an important role in the development of the fetus during the pregnancy. So the ovaries, we discussed that at ovulation, progesterone is created when an egg is released. We also stated that it forms a structure called the corpus luteum. So now we're on to breast tissue. So it also stimulates the growth of maternal breast tissue, prevents lactation, and strengthens the pelvic wall muscles in preparation for labor. In women, progesterone plays an important role in breast development. It mediates low-alveolar maturation of mammary glands during pregnancy to allow for milk production and lactation and breastfeeding of offspring after childbirth. Estrogen induces expression of progesterone in breast tissue, making it dependent on estrogen. Once labor occurs and the baby is born, the level of progesterone in the body stops steadily rising. If the egg is not fertilized, the corpus luteum breaks down the production of progesterone. The production of progesterone falls and a new menstrual cycle begins. The ovaries also produce progesterone in smaller quantities by themselves in the adrenal glands and the placenta during pregnancy. So before I talk about the disease it is associated, I'm going to talk about how progesterone is controlled. So how is progesterone controlled? Surge in luteinizing hormone production by the anterior pituitary gland triggers the formation of the corpus luteum. This surge occurs approximately day 14 of the menstrual cycle, and it stimulates the release of an egg from the ovary and the formation of the corpus luteum. Progesterone is then released by the corpus luteum, which prepares the body for pregnancy. The corpus luteum breaks down and the production of progesterone decreases if the egg is not fertilized and no embryo is conceived. When progesterone from the corpus luteum no longer maintains the lining of the womb, it breaks away and menstrual bleeding occurs, making the start of a new menstrual cycle. In the case of an ovulated egg being fertilized and creates an embryo, the cells that surround this early embryo will secrete human chorionic gonadotropin. This hormone is like the chemical structure of the luteinizing hormone, which means it can bind to and activate the same receptors as the luteinizing hormone. This means that the corpus luteum does not break down but keeps producing progesterone until the placenta is established. So with disease, high levels. Having high levels of progesterone has no known serious medical consequences. A condition called congenital adrenal hyperplasia causes high levels of progesterone. This is a consequence of the condition, not the cause of it. Um, Progesterone also, women that have had an increased risk, well, it increases the risk of developing breast cancer if you have high levels of progesterone. If progesterone levels are too low or absent, irregular and heavy menstrual bleeding can occur. During pregnancy, a drop in progesterone can result in a miscarriage and early labor. To delay onset of labor, a synthetic form of progesterone can be given to mothers who are at risk of giving birth too soon. When there's a lack of progesterone in the bloodstream, the ovary may have failed to release an egg at ovulation, and this can occur in women with polycystic ovary syndrome. So before I get into the summary, here are some other uses of progesterone. It is used as an oral contraceptive, the pill, either alone or in combination with estrogen. This pill prevents pregnancy by preventing ovulation. Progesterone is also used in hormone replacement therapy to relieve symptoms of menopause in women. So in summary, progesterone is a hormone that is released by the corpus luteum in the ovary. Progesterone is a hormone created when an egg is released from the ovary at ovulation during the menstrual cycle, where the remnants of the ovarian follicle, that includes the developing egg, form a structure called the corpus luteum. Its main purpose is to prepare the body for pregnancy. The egg released is fertilized. If this occurs, then progesterone stimulates the growth of blood vessels that supply the lining of the womb and stimulates glands in the womb to secrete nutrients that nourish the early embryo. And then having high, low, or no levels of progesterone in the body affects it in different ways. Women with high levels can have an increased risk for developing breast cancer, and then low levels or no levels can cause irregular and menstrual bleeding. This is my presentation on progesterone, and I hope you learned more about this hormone.